Side effects of stereotactic ablative radiotherapy. As with any treatment, radiotherapy can cause side effects. This video will explain the main side effects that you may experience and provide you with the information to enable you to sign the Royal College of Radiologists consent form and proceed with your treatment. Even with the sophisticated radiotherapy techniques that we use to treat cancer, we are not able to ensure that the radiation only targets the cancer. Some radiation will enter the normal tissue surrounding the cancer that we are treating, and this may result in some damage to those tissues, and you may experience what we call side effects. The side effects that you may experience will depend on where your cancer is in your lungs and what normal tissues are close to it. I'm going to explain the side effects that a patient receiving stereotactic ablative radiotherapy for a lung cancer may experience. This is not individualised for you. It's extremely unlikely that you will experience all the side effects I will discuss. Someone in your team, either the consultant radiographer, or specialist trainee doctor, will be able to explain which of the side effects may apply to you and if there are any less common side effects that are not covered in this video. It's worth remembering that the radiotherapy is delivered in an arc as the treatment machine moves around your body. This means that the beam is entering your body at many different locations, and so you may have something not right in a part of your chest that is different to where you think the cancer is. If you are worried about anything, then it's best to discuss with us. There may be a simple explanation which will make you feel less worried. This is all very new for you, so please don't be worried about asking us anything. Side effects associated with radiotherapy to the lung can be split into two groups: early side effects and late side effects. Firstly, early side effects are those that you may experience during the treatment and shortly after completing radiotherapy, and usually resolve within a few weeks or months. Most patients may experience some mild fatigue during treatment, and some patients may feel a bit more than mild fatigue, such that they have a nap during the day. This fatigue will improve after the treatment finishes, and by 4 to 6 weeks, most patients will be back to normal. Your normal lungs are surrounding the cancer we're trying to treat, and the radiotherapy beam will need to pass through this lung tissue to get to the cancer. The lung can be sensitive to the effects of the radiation, which may result in some inflammation developing in the lung. This may result in some cough and some shortness of breath. It might show some patchy change on an X-ray or CT scan. Rarely, this will start to affect your day-to-day life with increasing cough and shortness of breath. If this happens, then please let us know, and we will most likely arrange some imaging tests. Sometimes we prescribe some steroids, and if we feel that there may be an infection as well, start some antibiotics. It may be that you need to come into hospital to keep an eye on things. Occasionally, patients may feel a little bit nauseous and may be sick, though this is rare and may be related to other things in the radiotherapy treatment. We have good anti-sickness medication that we may suggest if this is a problem. If the lung cancer we are treating is close to your chest wall and ribs, then you may experience some discomfort in the treated area. Sometimes patients describe this as a short, sharp pain. Your own team will indicate if the cancer we are treating is close to the chest wall. Your skin around your chest may get a little bit red as you proceed with treatment. It may also feel a bit itchy in places. We advise using a soft towel and not drying the area too vigorously. Patting the skin dry should be okay. Please don't apply any of your own creams to the skin and let us know, as there are creams that we can give you to help. It would be unusual to experience severe skin changes, but if you're concerned with any changes, then please discuss it with the team when you attend for treatment or phone the cancer treatment helpline number. Very rarely, patients may cough up a little bit of blood. If this happens, then please let the team who is looking after you know. Please remember that as you go through treatment, you will be seen every day for treatment by the radiography team and once a week by the nursing team. So if you experience any side effects, then please let us know. On completion of your treatment, some of the side effects may become more of a problem. Remember that you have access to the cancer treatment helpline number, which is available 24 hours a day, at any time during treatment, and for the first 6 weeks after you've completed your treatment. We are all experienced in dealing with side effects associated with radiotherapy treatment and will be able to help. Some side effects of treatment may develop many months or years after radiotherapy treatment. Sometimes, if you experience significant side effects during or shortly after radiotherapy, then these may develop into side effects you experience in the longer term. Again, if your lung cancer was close to the chest wall, then over time you may experience some pain in the chest wall. The ribs close to the tumour sometimes will receive a high dose of radiation and may be at risk of developing a fracture, which can be sore. It is common that after radiotherapy to your lung cancer, the surrounding lung tissue will never go back to normal. The lung tissue will always look abnormal on an X-ray of your chest or a CT scan. For most patients, they will not be aware of the scarring in their lung and it won't affect their breathing. For some patients, however, there can be significant reaction to their normal lung tissue after treatment. These patients may experience a dry cough, shortness of breath, and feel generally unwell. If this occurs, it is important that you let us know. We will most likely organise imaging and may suggest treatment with high-dose steroids and possibly antibiotics. If this occurs, then most patients will experience some long-term change to their breathing and feel more short of breath. It is unlikely, but it may compromise them to the point that they are breathless on minimal exertion or even at rest. It may mean that they require long-term oxygen therapy, and it may result in them being housebound. This is a very rare outcome from treatment. If the lung becomes significantly damaged as a result of the radiation treatment, then it may be a site that allows infections to develop more easily, and it could result in an abscess developing in your lung. The main airway to your lung may be at risk of becoming narrowed and may bleed. This is very rare. Lung cancers at the top of your lung may be near a group of nerves called the brachial plexus. These nerves cross the top of your lung and supply sensation and power to your arms. It is very rare for these nerves to be damaged because of treatment, as we keep the dose to these nerves as low as we can and below the level that we think may cause damage. Rarely you may experience some altered sensation and function in your arms. If this happens, then please let us know. Your heart is in the centre of your chest and can sometimes be close to the cancer we're treating. Sometimes the lining around the heart can become inflamed, and that may cause some chest pain. Very rarely, and probably many years after treatment, the heart may not pump quite as well and may develop an abnormal rhythm. This is again rare. Radiotherapy is a very effective treatment in dealing with cancer. However, radiation can sometimes cause cancers. The risk of a cancer developing in the area we are treating in you is very rare and may take years up to decades to develop. The risk of this is outweighed by the benefit we expect you to get from the treatment we are proposing. Radiotherapy treatment is usually very safe and tolerated well, but legally we need to let you know that as with any treatment, there is a very small risk of death on radiotherapy. Thank you for listening to this video. It is worth remembering that the majority of patients tolerate radiotherapy well, and there are few serious side effects. Your team feel that radiotherapy is the best treatment option for you, and therefore the benefits of treatment clearly outweigh the risks. The whole team is experienced in dealing with side effects. Please let us know if you are worried about anything and we will do our best to deal with it. This video will always be available for you and your family to watch back and check if you're worried about things you may be feeling. You will now be asked to sign the consent form to allow us to proceed with your treatment. If there are any of the rare side effects that you may be more at risk of due to the position of your cancer, then the team will highlight this for you. If you have any questions in relation to the side effects, your treatment, or anything else, please ask your team.